In this lecture, I'm going to be explaining the theories behind corrected calcium. It usually comes up in clinical discussions, especially in patients with hypocalcemia, and I'm going to tell you why. Generally, 99% of body calcium is found in the skeletons, especially the bones and the teeth. The remaining 1% is distributed into different parts of the body, including the nerves, the muscles, and the blood, in which a derangement can predispose the patient to symptoms of either a hyper or hypocalcemia. The small proportion of calcium found in the plasma can either be free, protein bound, or complex to other molecules. About 50% of plasma calcium circulates freely in the body, and this is the physiological fraction that participates in several metabolic activities. So, if the free calcium is high, patient will have symptoms of hypercalcemia, and if the free calcium level is low, patient is bound to have symptoms of hypocalcemia. And because of this, the amount of free calcium is tightly regulated in the body to ensure that the value does not go beyond the reference interval. The second fraction of calcium in the plasma is protein bound, and they make up about 40% of all the calcium in the plasma. Consequently, the amount of plasma protein available to bound the calcium is very essential, because if there is a drop in the amount of plasma protein to bound this circulating calcium, then there will be a drop in the amount of protein bound calcium fraction. And this informs the critical relationship between plasma protein level and plasma calcium. The remaining 10% of plasma calcium is usually complex to other substances like citrate, phosphate, lactate, and the rest of them. And we rarely talk about them because they hardly contribute to any clinical significance. Therefore, it is reasonable to say that total calcium in the blood is equal to complex calcium plus free calcium and protein bound calcium. Now let us address a question. How does the availability of plasma protein affect total calcium? Remember I said that total calcium is equal to complex calcium plus free calcium plus protein bound calcium. Now, in a situation where a patient has a clinical condition that leads to a drop in plasma level of protein, it will mean that there will be less protein available for calcium binding. So this fraction of total calcium will drop because the free calcium is tightly regulated and it will not take extra calcium from this fraction. Okay, now that the protein bound calcium has dropped, free calcium has remained the same, complex calcium has remained the same. The final or eventual effect on the total calcium is that the value of total calcium will drop every time there is a drop in the availability of plasma protein for calcium binding. So generally, a drop in the circulating level of plasma protein will cause a drop in the level of total calcium. Here, it is important to state that most of the protein binding done by calcium is usually by albumin. In fact, up to 80% of protein binding is done by albumin. So any clinical condition that will affect the level of albumin in circulation will affect the amount of total calcium of the affected patient. So this is what gives birth to the concept of corrected calcium, which simply implies that what would have been the correct value of calcium if the albumin of the patient has been normal. So in most patients with hypoalbuminemia, which has reflected as hypocalcemia, we want to determine what the actual value of calcium would have been if the albumin level has been normal. In essence, we want to remove the effect of the hypoalbuminemia on the apparently low total calcium, and this is what gives rise to the concept of corrected calcium. So, in order to calculate corrected calcium, you need to obtain serum calcium of the patient and serum albumin of the patient that is obtained at the same time, and you impute them into the formula written below. Total calcium is equal to serum calcium plus 0.8 into 4 minus albumin. And depending on the SI units given, you can also say that serum calcium plus 0.02 into bracket 40 minus albumin in gram per liter. Whatever value of total calcium you get after the calculation will give you an impression of the correct calcium level of the patient after removing the effects of the hypoalbuminemia.